Hi, I am Dr. Keita Williams. You may call me Sister Keita Williams, but for the purpose of this, I'm Dr. Keita Williams, and I just wanted to say thank you for joining us tonight for To Get Her Healthier. And tonight we're going to talk about stroke. I'm a board certified neurologist, and that means I see patients who have had strokes, who have seizures, headaches, strokes, myasthenia gravis, multiple sclerosis, the entire gamut. But tonight I want to specifically discuss with you all about strokes and also about how to prevent them. We're also going to talk about what it looks like when you or your loved one is having a stroke. So before we get started, I want to open up in prayer first. Lord God, in the name of Jesus, we just come before you tonight, Lord God, just asking that you would be with us, asking that you would be in the midst, Lord God, asking that there's anything that you want us to know as it pertains to this type of illness and this unfortunate type of occurrence that occurs. Please, Lord God, don't let me forget to say that, Lord God. And Lord God, just asking right now that you would help people to be edified by what I say. And Lord God, we just ask that you would help them to be enlightened in ways that they can basically go out and prevent themselves from falling prey to this preventable illness and their loved ones as well. So we thank you, we praise, we magnify, and we adore you. In the name of Jesus, we pray. Amen. I just wanted to say, I want to acknowledge the president of the International Women's Department in the personality of Dr. Winning Woman, Dr. Dorcas McCoy, and acknowledge what you are doing to make this possible for those of us to come out here in this space to enlighten other sisters in the Lord, other winning women, so that we can go back and help those who live with us. So thank you so much for your efforts. And thank you to each and every one of the physicians who is basically joining forces with me to get her healthier. All right. So now that we've gotten that done, I just want to say that the reason I'm on video as opposed to being with you live is because while you're watching this, I am actually taking care of stroke patients. I see stroke patients right here from where I'm sitting. Thankfully, due to modern technology, I'm able to show up on the screen when people are in the emergency room. Now, many of you watching have been in the emergency room when a video cart was wheeled into your room and you were able to talk with a doctor on the screen. Thanks to modern technology, we are able to be present with patients in less than 5 minutes of their arrival in order to basically give them service that is very much, it depends upon the time, basically, especially when you were talking about stroke. Time is brain. And so I want to go into that with you now without any further delay. We're going to talk about what it means to have a stroke. So I'm going to share my screen with you. And I just want to give some stroke education at this time. Okay. So first and foremost, I just want to kind of reduce this. Hopefully you guys can see my screen. So the question is, would you be able to recognize and react to a stroke? This one says, Dad could lose everything to stroke, but you have nothing to lose. Okay. Calling 911. What we want to let you know, react, okay? Don't regret. 911. If you think you or your loved one is having a stroke. So now we're going to learn about the sudden signs and symptoms of stroke. Okay. So first and foremost, I just want to let you know that you need to be prepared to recognize a stroke. And then after you recognize a stroke, take immediate action. Oftentimes what will happen in the emergency room is people will come after the fact, a day or two later, and it's too late for us to be able to give the life-saving medications that can reverse the symptoms of a stroke. So it is important to act immediately. If you even think that if you just mildly suspect that someone is having a stroke, act. So let's talk about that. The symptoms are sudden and they are serious. The symptoms of a stroke can be easy to miss. Okay. So what you're going to look for is if your loved one is not acting like themselves. Okay. Something is a little bit off. Their speech may be a little slurred. They may not be with it cognitively. Those are things that you want to pay attention to. Now, you don't want to wait and see if the symptoms go away. That is not an option. People who have done that have regretted it later. Not trying to scare you, I'm just trying to let you know that if you wait to see if the symptoms go away, you're wasting precious time. And that time could be spent getting your family member or yourself the help that is desperately needed. So when it comes to stroke, basically, I've made this clear, time matters. Your immediate action can prevent brain damage, and it can also prevent long-term disability. So first and foremost, let's talk about how we would recognize the stroke. Remember, if you don't remember anything else I've said or anything else I'm going to say, remember this: be fast. Be fast. That stands for balance, okay? Loss of balance or dizziness. Eyes, vision changes. Fast, that's F8. At the face, facial drooping or severe headache, okay? The A stands for arm weakness or numbness. The S is speech, trouble speaking or confusion. And the T is time. You have to call 911 immediately. Now, let's go more into these symptoms of a stroke, okay? So when we talk about the loss of balance, what could be happening in your loved one is that they could have some issues with coordination, unable to walk. They may be kind of past pointing or reaching for something and missing it, okay? All of that deals with coordination. They could say that they're feeling lightheaded or dizzy or the room is spinning, okay? That all falls under balance, okay? Now, that's what they are experiencing. But what are you looking at? When you're looking at them, what are you going to see? You're going to see your loved one wobbling around. They may be grabbing something and past pointing and missing it. They may be tripping over nothing, right? Like they could be walking and tripping and falling and stumbling, and there's nothing there. You may see some unsteady movements, like they have motion sickness, or even they may stumble and they may appear to be drunk, okay, without having any alcohol at all. That's a symptom. That's something that you want to look for. Another one, letter in our be fast is letter E. So what we're going to look for in this case is with the eyes, okay, any vision changes. So they're going to complain of having blurred vision. They may say that they have some difficulty seeing out of one or both eyes. They may even mention, you may look at them and notice that they're squinting or rubbing their eyes or not able to read when, in any normal circumstance, they would be able to read. The F stands for facial drooping. Let me explain what that's going to look like. Your loved one's face may be drooping, may look uneven. Something's not quite right about the face, okay? And that person may not realize it because you don't just walk around looking at your face. What I want you to do is you say, come on, smile for me. Give me a big smile. And when they smile, you're going to see that one side of the face is drooping, okay? Also, what you're going to notice is that sometimes they can't sense anything. They don't have any sensation. So they could smile and then you may touch their face and they don't feel anything or it's different. You touch them here and here. Say, does that feel the same on both sides? They say, no, it's less on this side. Okay. That's another sign, another symptom. Now, the other thing is that they may have some pain or discomfort in their head, scalp, or neck without a reason for having that. If that's the case, you're going to notice that they may be touching their head or rubbing their temples or being super sensitive to light. So another sign. Now, let me say this. Every time your loved one has a severe headache, we're not going to call 911. We're going to look for other symptoms that may be with that as well. Now, if you are calling 911 each time, I'd rather you do that and be wrong every time than not do that and be wrong. Okay? And miss out on an opportunity to get your loved one some help. Now, the next thing I want to bring out is lack of strength, weakness. Okay? So that's on the A, and they just said arms beside A, but I'm going to go into more detail. When we talk about arms, we mean arms and legs, okay? You're supposed to have good strength with arms and with your legs, okay? If that loved one is not able to move the arm on one side of the body, not both sides, because a stroke, and I'm going to get my brain in a minute and show you guys, a stroke usually affects one side of the body. The side of the brain the stroke occurs on affects the opposite side of the body. So they're going to have weakness on one side of the body, weak leg, weak arm, or just weak arm or just weak leg, but not both arms and both legs. So if your loved one has lack of strength in one arm on one side of the body, or they complain of a tingling feeling in their face, arm, or legs, feels like pins and needles, just on one side. I'm not talking about neuropathy, which will be bilateral, meaning both sides, both feet, both hands. No, just one side feels like pins and needles. Okay? Just one side is very weak. Then what we're wanting to do is we need to call 911. Now, what would you notice? Maybe they don't notice anything. And that happens a lot where the patient is having a stroke, they notice nothing. But the family notices, guess what? The person is wanting to lie down, or they're wanting to sit doing very simple tasks. You know, something they normally would stand up doing. Now they just want to sit down, and you don't understand, why are you sitting down doing something like this? It doesn't make sense. Well, they're really sitting down, but they're compensating because that one side is weak. Or maybe they're constantly touching or rubbing or massaging or shaking the numb area. So they keep doing this. So maybe their arm isn't weak, but it's just numb. And they're like, ooh. And you're like, what's going on? Well, my arm is numb. Okay. You need to start asking some questions. When did it get like that? How long has it been that way? We'll get to that in a minute. The S stands for trouble speaking. So they're unable to speak. If you're looking at them and they're trying to get a word out and then they can't, and they're just crying, because that makes people kind of upset. They're trying to speak and they can't get anything out. You need to call 911. Or if they're speaking and their speech is okay, you can't make out what they're saying because their speech is so garbled. Another reason to call 911. Now, what if they're unable to understand what's being said to them? They can't think clearly, or they're thrown off, or you're talking to them and they're saying, huh? What? Huh? They can't understand what you're saying. That's another symptom. Here's the deal. A stroke can cause an aphasia. Aphasia means inability to speak. And you can have, there are several different types of aphasia, but I'm going to sum them up into two kinds just for the purpose of this lesson. Number one is an expressive aphasia, meaning that you cannot express what you want to say. You're trying to, but your words come out wrong. So you want to say one thing, but something else came out. Or you're trying to say it, but it won't come out. And it's like a severe version of something that all of us get, which is the cat's got your tongue, or how people say it's right on the tip of my tongue. Okay, that's normal. Okay, we all get that. People have different names for it, all that. We all get that. Like, oh, what is that? Okay, that's normal. But in this case, this person, it can't get anything out. Everything is coming out broken up or jumbled, and they're pausing and they just can't. That's aphasia, and that can be due to a stroke. Now, that's an expressive aphasia. Now, what about a receptive aphasia? So receptive means your ability to receive something. So if I'm talking to you and you don't understand what I'm saying, then at all, then you could be experiencing a receptive aphasia, meaning I can't receive it in my brain at all, what you're saying. Now, a person with a stroke, if they're having that, that's going to be profound. Not going to just be like, huh? Can you explain that? Nothing like that. No, they're not even going to, you're going to tell that they're out of it. They're not able to comprehend what's being said. Okay. Now, that's what the person is going to experience. Now, what you're going to see is, this is what you're going to see them do. You're going to have sentences coming out of their mouth that you can't understand. You're going to have a difficulty having a conversation with them. All right. Now, that's if they're having an expressive aphasia. But if they're having receptive aphasia, you're going to notice that they look puzzled because they're not understanding anything. They're like this. Or they're going to have a wrinkled expression on their face or shaking their head no. They have a hard time focusing and they can't make a decision on what to do because they can't process anything. Okay. Now, the last and final letter in this acronym is T. And T is simply time, because you don't have much time before you need to call 911 and get your family member some help. Okay. So that's what we're looking at there is time. Now, you have, and we'll talk about this, I think it comes up in another slide, but essentially why I keep harping on time is because we now have medicines that if they're injected within 4.5 hours from the start of the stroke, we can bust up that clot and that patient can go back to being their normal selves. Okay. That is why time means everything. Now, in some cases, if we're beyond the 4.5 hour mark, we can go in and do surgery and actually remove the actual clot. All right. That's called a thrombectomy. We can remove the thrombus. That if any time from the start of the stroke to 24 hours later. But that's not our goal. Our goal for you is to get there before 4.5 hours. That's our goal, is for you to get to the hospital within that 4.5 hour period so that something can be done immediately. And you don't have to be life flighted to the nearest hospital where they can do a thrombectomy. Now, next thing is who is at risk for a stroke. A stroke can happen anytime. And there are some risk factors that we're going to talk about today. And those are age. Age is one of them. So as you see on the screen, about 1 out of 5 people who have a stroke are under the age of 55. Your chance increases as you get older. Race is also a factor. So African Americans, Hispanics, Pacific Islanders all have a higher risk of stroke than people of other races. Now, I have my thoughts as to why that is, okay? And one thing I just want to mention is that stress can have a huge impact on a person's risk for a stroke, okay? And stress raises your cortisol levels. And when your cortisol levels are high, this is a side note, when your cortisol levels are high, it increases your risk for other things, okay? Like diabetes, inflammatory processes of any kind, okay? And stroke, what happens in the blood vessels with stroke, all of that is due to inflammation. So anytime you have high stress levels, and there are reasons why African Americans may have a higher stress level, all right? We don't even need to talk about systemically what has happened throughout the years. I don't even have to give you a history lesson. I think everybody understands what I'm talking about. There are reasons that cause us to have a higher level of stress than others, which I believe has contributed to our having a higher risk of these kinds of diseases. Now, I cannot overlook the fact that diet contributes as well, all right? Diet, eating foods that are highly processed, meaning anything in a box or a bag, anything with a long list of ingredients and list of things on the back. Those are processed foods. Eating diets high in those things can also increase your risk for a stroke, heart attack, diabetes, hypertension. Hypertension and high cholesterolemia. All right. Gender. More women have stroke than men. And more women die from stroke than from breast cancer every single year. Who knew that, right? Family history. You're at greater risk if a family member has also had a stroke. So keep that in mind as well. Now, thankfully, the risk factors are manageable. Most of them are. Blood pressure is manageable. Atrial fibrillation. If you have an irregular heartbeat and you know it, then you're probably on a blood thinner. You need to take it. Don't play around. Take your blood thinner if you have an irregular heartbeat, because what's happening is that heart, if it's beating irregular, it's like this, or it's quivering. And a heart that's not giving a full thrust is allowing blood to clot in the heart. And clotted blood resting in there, when that heart finally decides it wants to give full, then guess what's going to happen to that clotted blood? Whoosh, it's going to go up here and lodge in a small vessel. That's why you need to make sure you take your blood thinners if you've been given a blood thinner and you have an irregular heartbeat. High cholesterol is also preventable with diet, okay? Smoking, diabetes, poor circulation, lack of physical activity, and obesity. These are all things that can be prevented. Talk to your doctor if you have poor circulation, because there are things that they can do. Sometimes you can have on the TED holes. Sometimes if your circulation is bad enough, they'll even give you a medicine that helps your heart to beat harder, beat stronger, to make sure the blood pumps like it should. All right. Oh, I could stay on this slide all day because there's so much in there that I just really wish I could talk to you guys about. But I know that we have to keep it moving due to the time. The next thing is get the facts on stroke. Educating yourself about stroke can be life-changing. You're doing that right now by watching this. You're educating yourself. Knowing when someone is at risk for a stroke, the types of strokes that they could potentially have. I'm going to talk about that in a minute. As a matter of fact, I'm going to just make myself a couple of notes that I want to have just to go back and talk to y'all about different types of stroke and some various things that I want to talk about. And what is a stroke? So I don't know if we even talked about that, but it's a brain attack. And let me grab my brain real quick. Okay, I can't see myself on this, but I'm going to come back and talk to y'all about that when I'm back on camera. It's a brain attack when the blood vessels in the brain basically are blocked, or if those blood vessels burst, that's a stroke. Because basically it keeps the blood from getting to another part of the brain. Essentially, the plumbing there is messed up, and you can't get the blood to the other part of the brain. And we all know that blood carries oxygen and nutrients. So your brain cannot live without oxygen. It cannot. And the consequences of a stroke can be long-term, can even cause death. So we're going to talk about what happens during a stroke and the different kinds of stroke. Okay. I want to say to you, call 911. EMS can be there to help you. Do that for your patients, the ones you love, your family members, the people that you love. Now let's talk about this. Let's unpack everything I just said. So here is my brain here, and I like to show my brain to my patients. So this is the brain, and this is the upside down brain, but this is how the brain looks right side up. Okay. So if this is your head, let me just show you. This is the front part of your head. This is the back. So this is the frontal lobe. The frontal lobe. So the brain is divided into two hemispheres. See this line here that goes down the middle? That separates the right hemisphere from the left. All right. So this is the frontal lobe. This is considered your temporal lobe right in here. Okay. All this area here. This is the occipital lobe back here. And right here is called the cerebellum. This controls balance. And let me flip the brain upside down to show you this area here. Okay. So here we have, this is called the medulla oblongata, this long part here. And this keeps going until it becomes your spinal cord. So right side up, that becomes your spinal cord. This is called the pons right here, okay? Now, a lot of the cranial nerves that serve to give us sensation to our face and motor movement or activity of our face are housed right here. So I'm showing you all this because this is how we can tell wherever the stroke happens, it affects the part of the body that part of the brain serves. So let me go back to my first example that I started to give you all, and that is this. You have a patient, a person, a family member, your husband, your grandmother, your mother, whomever, and they happen to stop talking. They can't make any words out. That's because there's an area on the side of your brain in this temporal lobe that basically allows us to have speech. And when that area, if there's a stroke that happens that prevents blood from getting to this area here, then you're going to have issues with speech. You're going to also have issues with movement. But guess where it happens? On the opposite side of the body. So a stroke on this side of the brain will affect the other side of the body. It doesn't matter to you guys because it's just a stroke essentially, but for us as neurologists, it matters because we can kind of tell what kinds of deficits you're going to have depending on where your stroke is located. So long and short of it is that with a stroke, you have blood vessels, and I like this blood vessel. This is called the basilar artery right here, this big one here. And then it breaks into two vertebral arteries. That's one and there's two. And so here we go. If you have the basilar artery and off of it comes several other arteries that serve the pons and the midbrain and then the cerebellum. If you have a stroke, let's say in one of these arteries, whatever it is, whatever part of the body that artery serves is going to be deprived of blood. If it is deprived of blood, then what happens is that part of the body stops working. Now, what happens when you get TPA or tenecteplase, either of those two drugs that help to bust open the clot, is that drug will go in, and wherever that clot is, it will make that clot dissolve. Okay, so if the clot is in there, it makes that clot dissolve, and now blood can freely flow there now, and go and that blood can go to the area of the brain where blood was missing at first. And now you have full functionality again. That's why time is brain. You need to get to the hospital in time so that you can get the clot busting drug that will help you. Now, another type of stroke is called a hemorrhagic stroke. The first kind of stroke I told you is called an ischemic stroke, which means there's blockage there. They're leading to ischemia or lack of flow. The other kind is called a hemorrhagic stroke. And a hemorrhagic stroke is where the blood vessel bursts, okay? A lot of times we see people who have, say, an aneurysm. Now, let me talk to you about aneurysm. And in order to do that, I'm going to have to take my brain apart. So y'all just bear with me here. I'm going to take my brain apart. And I'm going to show you guys about an aneurysm. Now, the aneurysm generally happens in an area called the circle of Willis, which my brain doesn't show that because it's really kind of right in the middle there. But let me tell you, a lot of times an aneurysm can happen in this area in the middle kind of brain and in the circle of Willis. And in that area, when that aneurysm happens, blood goes everywhere within the brain, and you only have a little bit of time, okay, to get help. That is why we rush and get a CT scan, because the CT scan will show us immediately if that patient has blood in their brain. That's emergency. We need to evacuate the brain immediately, which means that they may need to get a hole somewhere where we can let there be some outlet for the blood, because there's not a lot of space in there. And it can get tight in there real fast, because guess what? This is taking up most of the space in there. And if it starts to swell with blood, there's only a matter of time before you could herniate through the hole. Basically, there's a hole here that lets that spinal cord come through. If your whole brain is swelling in here because of the blood, if the blood is building up, your brain is going to try to go down through that hole. Can't do that, because if this is trying to go down through the hole, it's going to cut off your respiratory drive, right? And you stop breathing. That's how people can die immediately if they have that. Another reason why time is brain, okay? I hope I'm not giving you all too much of a biology lecture, but I want to let you know about it. Now, the other thing I want to mention is, so that's called a hemorrhagic stroke. The other thing I want to talk about is something that's not talked about enough, and that is when people have a genetic disorder that predisposes them to having clots. A lot of times people don't realize that that is a genetic disorder until they've had a couple of 2 or 3 strokes at a young age. And then they finally get evaluated. But medical professionals, it's our job to recognize this early on. And one way we can recognize it is, and I would love for my OBGYN community to help out with this a little bit more, a woman who has multiple miscarriages. Oftentimes that is an indication that she has a clotting deficiency, a clotting disorder that causes her to clot too much. And oftentimes that is genetic. So oftentimes what we'll find is we'll see that people have a genetic disorder that causes their blood to clot often. And they'll start off at a young age having several miscarriages. Now, what that looks like as they progress is this. They'll then start having, what we'll see, unfortunately, is that they'll start having DVTs or maybe blood clots in their legs, or they'll start having strokes at age 20 or 30. Anybody who has a stroke at age 20 or 30 needs to be tested for a hypercoagulable disease or disorder or genetic deficiency of some kind. And so there are certain labs that they need to check you for. Hypercoagulable, and I wish I had met a slide with that spelled out. Write this down. Hyper, Hyper, coag, COAGU, coagulable. Okay, so we're going to spell the whole word. Okay, hyper, Hyper, coagulable. That's COAGU, able, ABLE, coagulable disorder. Basically, you know, if you have that, if you know, and I ask people all the time. I had a patient last week. She was maybe 49. She'd already had 3 strokes. She had 6 miscarriages, and nobody had ever tested her. And I said, ma'am, has anybody in your family ever had multiple miscarriages? She said, yes, my mother had, I don't know, 6 miscarriages. And she said, my mother had a stroke. She was naming all this clotting stuff that was happening. And now here she was at 49, already having had 2 strokes. Unfortunately, unnecessarily, because had someone caught that early on after she had, you know, her multiple miscarriages on miscarriage number 2 or 3, they could have started her on medicine that could have stopped her blood from being from clotting so easily. And she would not have had to have gone on to have strokes like that at a very young age. I see it all the time. So just be aware of that. Sometimes you have to educate your doctor. It's true. It's true. Educate your doctor. I'm so serious. Why do I say that? I hate to have to say this, but I'm going to have to go there. Okay. A lot of times you go in there and I want you to be taken seriously. I want you to be looked at and seen and heard and valued. I cannot guarantee that's going to happen everywhere you go. Okay. And because of this, you're going to have to go in there with some information and some knowledge so that you're not overlooked or dismissed. I'm giving you information. Go back and watch this video, write things down, especially pertaining to that, because that I see all too often where people are overlooked. That should be caught in the OB department. That shouldn't have to be caught in the ER after you've had your 3rd stroke. I'm telling you all this so that you will have it and you'll know. Help your granddaughters, your daughters, whomever. Okay? It's in the family. It continues to affect the next generation. Also, I know I don't have much time, but if I did, I would talk to you all about how your food choices can keep you from having a stroke. Maybe that's a different discussion. But I just want to say the more you eat that grows straight from the ground, that doesn't have a label, the better for you. That means green leafy vegetables. That means broccoli that's just steamed, not drenched, not swimming in cheese. Okay. The more of that you could eat, the better. The less of the dairy. The dairy, a lot of times there's hormones in that stuff can cause inflammation too. There's a lot of that can lead to other problems, raising the cholesterol, things that lead to inflammation. The stuff that leads to inflammation are those boxed and bagged products that are processed. That leads to inflammation, which leads to so much other stuff in our bodies. If we could get back to eating the way God intended, which means if it grew from the ground, we're good. Okay. Leafies, not soaked in fat back and all that kind of stuff, because then you take away the nutritional value. But if you can eat the stuff that grew from the ground, there are far more veggies than there are other stuff. Okay. And I'm not trying to tell you to become a vegetarian, but if you do eat meat, make sure that it's organic. Make sure it's not deep fried. Make sure that it's baked. Make sure it's not sitting in its own fats and oils. Okay. Doing those kinds of things so that we take control and full control over our own health. Berries are great for you. If you can drink a berry smoothie every day with your blueberries and your strawberries and your raspberry, whatever you want to put in your smoothie, pomegranate juice, add that. There's some amazing free recipes and with foods that have antioxidants, very high in antioxidants, like berries, like pomegranate juice. Those kinds of things are high in antioxidants, and antioxidants help to prevent cancer, reverse cancer. Okay. And so it didn't mean for this to be a cancer talk, but a lot of what we eat is causing cancer, can be carcinogenic. So just keep bear all of that in mind, and let's try to do better by ourselves. Let's try to do that, because I think I froze. Okay, I think I froze for a second. And so anyway, if we can do right by ourselves, then our outcomes will be better. All right. So if y'all want to hear more on this, just put that in the chat and Dr. Dorcas McCoy will let me know. She'll let me know if you guys are wanting more information on that, and we can move forward. All right. Well, thank you so much for listening. I'm Dr. Keita Williams. And until next time, just eat healthy, be cognizant, be aware, educate yourselves. Don't go in there blind. And thank you so much. And God bless you all. Love you so much. Winning women. God bless you.